Welcome, everybody, to the Rural Health Transformation Program technical assistance call. I am going to wait a couple minutes to get to that 3 o'clock time frame before we get started, but welcome to the call. Okay, we're a minute past the start time of 3 p.m. and we want to be thoughtful to people's time and attention. And so just going to get this technical assistance call started. This is an exciting moment for North Dakota and for Health and Human Services. This is our very first technical assistance call for our very first grant related to the Rural Health Transformation Program. So this technical assistance call is being focused on the grant opportunity of workforce retention funding for critical access hospitals and their owned and operated clinics. So that is the purpose of this call. I know that there's been a lot of excitement around the Rural Health Transformation Program, and there may be lots of questions related to that. This call is directly and specifically for technical assistance related to that workforce retention funding opportunity. So with that being said, Anna, can we move to the next slide? So the agenda for today's call is at a high level, we want to help applicants feel confident and prepared in their applications. So we're going to be reviewing the funding opportunity, highlighting key requirements, and then we are going to provide a space for questions. I would ask that throughout this entire presentation, if you have a question, feel free to put that in the chat. We do have a couple team members. Steve Burgess is going to be tracking that in the chat, and then at the end of the presentation, we'll be going through each of those questions. And if the time allows, we will be opening up the mics to allow for just more direct Q&A questions. I know in other technical assistance calls that I've been on, if you don't get to have that question and answer period, it's a little bit frustrating. So we want to be thoughtful to your time and make sure that we're giving you the answers that you need. And the next slide. So just as a high level overview, the Rural Health Transformation Program was authorized by the One Big Beautiful Bill Act, and it provided $50 billion to 50 states over 5 years. We were the agency that was selected to submit the application from North Dakota to CMS, and we were awarded $198.9 million for the year one, which is from December 29th, 2025 to October 30th of 2026. In our application, we identified 4 initiatives: make North Dakota healthy again, strengthen and stabilize rural health workforce, bring high quality healthcare closer to home, and connect technology, data, and providers for a stronger North Dakota. The grant opportunity we're talking about here fits right into that number 2 line of strengthen and stabilize rural health workforce. Next slide. We do want to talk about funding opportunities in general. Funding opportunities will be released in phases with individual applications announced over time. So this is the very first funding opportunity that we have announced and the very first one that we're sending out. Each funding opportunity will have a unique purpose, eligibility, and timeline. And future funds will be determined based on our progress in meeting what our application was. So our success is based on your success. So we really do want to make sure that we're giving you guys all the information you need to do a good, solid application. And we want to remove as many barriers as possible to make sure that we have successful applications and accessible progress. Next slide. The workforce retention funding and critical access hospitals and their owned and operated clinics. That's the funding opportunity that we're here for today. There is the solicitation number that everybody should be applying for. Just as a high-level overview, there's $10 million that has been set aside for this one funding opportunity. There is an estimated of 37 awards, which each one being $270,000 each, expected to be made in this year one opportunity. We are, however, asking that each of those award submissions submit a prioritized funding proposal. And we're doing this because, and those amounts can be over the $270,000 threshold. We're doing this because if there's funding maybe not being able to be executed in other parts of the Rural Health Transformation Program, we might want to dip back into this funding opportunity and award additional funds if possible. We'd probably be looking at doing that around the August timeframe. So we do encourage all applicants to submit their prioritized funding proposals, and anything that they have over that $270,000 threshold, we'd want to keep that in mind for other opportunities that might have flexibility that moves forward in the future. Next slide. Just for eligibility sakes, the eligible applicants for this opportunity are critical access hospitals that include their own and operated clinics. We are asking the applicants attach documentation demonstrating formal approval of the grant application by their governing body. So that'll be part of the project narrative, strategies, outcome, and measurable outcomes portion. There is no priority considerations given to these funds. The target populations that we are focused on in this opportunity would be workforce groups such as medical and nursing staff, allied health professionals such as behavioral health specialists, rad techs, respiratory therapists, lab technicians, physical therapists, occupational therapists, and dietitians. Next slide. The purpose and outcome of this opportunity is to strengthen and stabilize the rural practice environments, ultimately improving the access to care in rural communities. The outcomes that we identified in our submission to CMS is to increase the rural provider retention rate at years 3 and 5. We wanted to reduce health professional shortage areas, and we want to increase rural primary care prevention retention rates. With that being said, I'm going to turn it over to, there'll be 3 presenters other than myself. There'll be Courtney Peterson, who is our assistant CFO, and later you'll also hear Kim Mertz, who will talk about the grant opportunity more specifically. But I'll turn it over to Courtney right now to talk about the funding opportunities.
Thank you, Dirk. You can go to the next slide. All right, so our funding opportunity period will start here. Our timeline to receive applications is through the end of April, so April 30th by 5 p.m. Once those applications are received and reviewed throughout the month of May, we hope to have contracts and things signed shortly after that. Our obligation period is through September 30th of 2027, with our funding year ending September of 2026. Within that following year to September of 2027 for funds to be expended. For the application purpose, there will be a budget cover template and a equipment versus lease within all one worksheet. We do ask that you make sure on that very first cover page that you fill it in to its entirety, as that is the document that is submitted to CMS. On the second tab, that is the budget worksheet, please ensure that your justifications are thorough so that CMS has all the appropriate information to avoid any delays in our timeline. All of our applications, once we have gone through the screenings, do have to be approved by CMS. From there, we want to make sure within that budget template, there is also a match portion. Match is not required for this award. However, it is something that some areas have established to help with their sustainability plan. So they choose to input their match portion, and that is perfectly fine. So that is what that is there on the template, is an optional fillable feature. Go ahead, next slide. So while we're working through this timeline, some components that we can have you as providers or as applicants be working on is making sure that you're registered with the Secretary of State so that we are able to be setting you up as a contractor as soon as we are ready to go. From there, if your organization has never been paid from the state before, you will have to sign up through vendor registry so that we will be able to reimburse you for your contractual agreement. In order to be set up as a vendor, you are required to submit a W-9 form. so that we can get you within our system. Also from there, as this is a subrecipient agreement and it will have regulatory compliance areas, your organization is required to be registered with SAM.gov and receive a UEI number before you are able to receive funds. Next slide, please. So in the next few slides here, we go through some unallowable costs as they pertain to the workforce retention funding area, as well as they pertain to the entirety of the rural health transformation. So some may not apply to this direct grant opportunity, but we did want to bring them to your attention. So for this one specifically, there will be no administrative cost, capital expenditures, vehicle purchases, or indirect costs allowed for this grant opportunity. Staff receiving the incentives must be employed and on the payroll at the time the funding application was posted, so effective immediately. 5-year service commitments may apply. Providers currently participating in the state loan repayment program that includes a service commitment are not eligible for the financial retention incentives under this funding opportunity. And then last but not least, contracted or locum tenens providers are not eligible for retention incentives or projects, as these efforts are intended to focus on developing a long-term provider base. Next slide, please. This slide just gets into a little bit more detail as it pertains to rural health transformation, such as no pre-award costs can be included in your budget. Also, above and beyond that, supplanting is not allowable through CMS grants, new construction's not allowable, or replacing reimbursements by insurance. Next slide. Again, this is getting just more into the rural health transformation unallowable costs, but we wanted to make sure we highlighted some of them, such as some of our technology requirements, financial assistance to households for installation or broadband internet needs. The clinician salary and wages for facilities are subject to clinicians to non-compete clauses. And then meals and food have to be reimbursed at the GSA rates and on a per diem basis only. Next slide. And from there, I will hand it over to my counterpart, Kim Mertz.
Thank you so much, Courtney. Hi, everybody. I'm Kim Mertz. I'm one of the section directors here in the Public Health Division of HHS. I'm going to apologize up front for my somewhat horsey voice, just getting over losing my voice last week. It's been a tough winter with all the illnesses going on. So if for some reason I get too squeaky, Dirk is already prepared to take over for me. But let's get into the meat of the application. We really want to spend some time here so you have a good understanding of what we would like you to submit. So the application has a couple different parts. We have a background information. We have narrative that's structured in 2 different areas: identified need and proposed goals. And then there's a strategies, activities, and measurable outcomes. We have an action plan, and we have a budget. So now you're gonna, if you've spent any time on the website or if you've actually looked through the application, you're gonna notice that this is all very familiar to you, but we really just, again, wanted to highlight some of the important parts of this. There's much more detail, of course, on the website and in the guidance, but let's go through some of the parts of this. I do want to let you know that when we designed this, we did use an internal and external team of experts, program staff, financial people, HR. We had our comms people in on this. We had external partners, some partners from the Center for Rural Health. So there really was a team working on this for you to really make this as understandable as possible. And so we also want to let you know that this application was designed around federal requirements and what we need to report back to CMS. So with that, let's move to the next slide, Anna. Okay, the first part of the application is just simply going to be asking you for some background information. When you go into the website, you're going to see that the guidance is there. And so all of this is out in a narrative. You're actually going to be submitting the application in a Qualtrics survey, template. And so we're going to talk about that in a little bit, but I do just want to highlight that now. So when you go into Qualtrics, you're going to find this background information. There's going to be different boxes that you're going to put the information in. The first is simply your organization name and background. We want to be sure we know what the name of your critical access hospital is. Please note your location and its owned and operated clinics. And we'd like you in this part to include the estimated population that you serve throughout that whole system. The next box is going to ask you for the project lead and your contact information. We want to be sure that whoever you put in this box is the person that's going to serve as the primary point of contact to receive communications about your application. Okay. And then we're simply going to ask you for a project title and a brief description of why you're applying. Don't worry about the project title. Keep it simple. Don't stress over that. We're just kind of looking for just a simple title so we can kind of relate that to your project. All right, Anna, let's move on to the next piece. This is where we're going to get into the narrative now. And again, remember what I said, the narrative has two pieces: identified need and proposed goals, and then strategies, activities, and measurable outcomes. So the first piece, again, identified need and proposed goals. Okay, there's several different sections to this. So first, what we want you to do in this area is to discuss your workforce challenges and retention issues that your organization really hopes to address through this proposed project. And we give you some examples, such as, do you want to look at your staff turnover? Maybe it's your vacancy rates. Are you dealing with some burnout? Do you have childcare barriers? You can see that we gave some examples. We do want you to know that the examples that we've provided in the guidance are not exhaustive examples. These are just some kind of things to kind of get you thinking, but we know that each area, each hospital is going to have their own unique needs. So please let us know what those challenges are that you're having. Then we'd like you to describe your specific retention issues and include any relevant local data that would really help to support that. The next part of that is really outline your overarching goals and your target population. So when you're putting your goals in, just remember that a goal is a broad, high-level change your organization seeks to achieve. So once again, we've just provided some examples. Perhaps you want to strengthen workforce stability by improving retention among nursing staff and allied health professionals through initiatives that support long-term engagement and reduce turnover. So that would be just one example, okay? Then we want you to identify if there's any similar projects that are currently going on. This is a requirement of CMS. They very specifically want this identified in the projects. So this would just be if there is any identified similar projects. So we want you to, how you propose the project would either enhance or expand. Because remember what Courtney said, that this funding cannot be used to supplant. So you can't, if you're already doing a project, you can't use this money for a project you're currently doing. It has to be an enhanced or expanded or a new effort. Okay. All right, let's move to the next slide, please, Anna. I am going to spend some time here. We're going to be looking here at strategies, activities, and measurable outcomes. This is the part kind of where the real meat comes in here now. So in this part, we're going to ask you to really this is where you're really going to be describing your strategies and activities, okay? So once again, we've provided an example for you of what a strategy might look like. So for an example, reduce vacancy rates in nursing staff from 25 to 15% by September 30th of 2027 by implementing retention bonuses, enhancing childcare supports, and covering license renewal fees, contributing to improved rural provider retention. You guys are experts, I know, at writing grants, so I know that you definitely understand strategies and how to write those. We want to be sure, as Dirk mentioned earlier, we are letting you know that if you're requesting more than $270,000, we do want you to order these in priority. So when we get to that August mark, as Dirk had mentioned before, if we have additional funding, we may be able to fund other strategies or priorities that you have in your application. When you're writing your strategies and activities, again, I think we're all very familiar with this, the specific, realistic, measurable, and need to be aligned, of course, with the rural health transformation goals. So oftentimes you'll hear those referred to as SMART strategies. And again, I know you're very familiar with that. We want to remind you that with each strategy or service or task or activity that you're including, we do need you to provide significant detail to ensure that the scope is measurable and aligned with program goals. And there is more detail in this if you look in the grant guidance, but let me give you a quick example. If you're going to be doing something, say you're going to be offering bonuses, say retention bonuses. When you talk about that specific strategy, you need to describe how those bonuses are going to be implemented. What is your policy for that? How are you going to determine the funding amount? So make sure you give significant detail, and that would be as well like if you're going to cover licensing renewal fees. Are you going to cover those, on an annual basis? Which disciplines are you going to cover them for? So just make sure that you provide significant or enough detail so we can understand how you're actually going to be how that can be measurable. We do want you to know that we have included some examples of eligible workforce retention projects. If you go on the website and under the guidance, there's a part that says funding opportunity. And we did put a list of some examples that, again, are eligible workforce retention projects. Please know that this is not an exhaustive list. We did use the funding opportunity announcement that CMS put out. We looked through their frequently asked questions. We did some research on best practices. We used experts, but we know that we may have missed something that you guys think would be a good project. So please make sure that you, if there's something on the list that you think would be a good project, but you're not sure is eligible, just please reach out to us. So we would ask you to submit a question through the inbox. The link is there. We would really like to get that answer for you before you submit your application. If we don't know the answer, we'll reach out to CMS and we will ask them the question. We also wanted to point out that some of the financial incentives that are included with these retentions must be tied to a minimum 5-year service commitment. And we did note those with an asterisk in the example list. Once again, this is a CMS requirement. So if there's any questions about that, please feel free to reach out. There's going to be another section in this part that we want you to describe any of the policies, procedures, and approvals, including a 5-year service commitment agreement and a process for monitoring compliance. Now, we know that some of you might already have these policies in place. And so if you do, please describe that. If you don't have the policies in place, please just simply describe how you're going to implement or get those policies in place. Once we get your application and we review it and we send your agreement or contract back to you, that agreement will include instructions on how you have to submit that, because we do need copies of those policies that you have before you can actually issue any of those financial incentives or submit a reimbursement request. We are going to be working to get samples for you of 5-year service commitments and any other type of agreements that maybe you would like. And so we will be putting those in the FAQ document. So please know that those are coming. Another part of this is, Dirk had talked about this in the beginning. We do want you to upload documentation demonstrating formal approval of the grant application by the hospital's governing board. So when you get to this part in Qualtrics, there'll be a box in there for you to go ahead and upload that. That can be a letter from the CEO, that can be meeting minutes. The grant guidance will tell you what documentation you can submit for that. Another part of this is sustainability, very important part and a big requirement for us for CMS. Please refer to the grant guidance. We do have some questions in that guidance that we would ask you to consider as you're answering the sustainability piece. So, next slide, Anna, please. Okay. Continuing on with the strategies, activities, and measurable outcomes, there's going to be one last part of this. And we're asking you how your project aligns with elements of CMS's Rural Health Transformation project. And so basically, this is going to be a check feature in Qualtrics. If your strategies and applications align with any of those areas that are in the blue box, which are things like improving access, improving outcomes, technology, partnerships, workforce, data-driven solutions, financial strategies, and cause identification, we're going to ask you to check that, and then we're going to ask you to briefly explain how that aligns with that. Once again, this is a CMS requirement, and so we're going to ask you to complete that. All right, Anna, let's move on to the action plan, which is next. The action plan has 3 phases, a timeline and milestones. This is where we're going to ask you to provide the timeline to successfully implement the proposed project. Remember that the start date is when the contract is going to be implemented. So when you're doing your timeline for a start date, you can simply put time of contract fully executed, and then put your end date, of course, as well. Just as a reminder, that end date, you do have till September 30th of 2027 to expend all of these funds. So the end date on your action plan can't go past that date. We want you to identify key milestones and estimated completion dates for each of those strategies and activities. Next, it's going to ask for metrics. And so for each outcome, we're going to ask you to identify the metrics you're going to be using to kind of monitor things as you're going along and how that progress is going to be tracked. And then we're going to ask you to identify key personnel, including a project lead. And then if you're going to be using any external sources like consultants. So on this in Qualtrics, you're going to see there's 3 separate boxes for this. We really went back and forth about how to put the action plan in Qualtrics. We know that sometimes using a table format, which I think we're all used to when we use it, when we develop an action plan, sometimes has a better flow to it. But when you put that in Qualtrics, you're limiting the space and things get a little bit wonky, quite honest. And so that's why we decided to have 3 separate boxes for this. And so we hope that isn't too confusing, but please know that there are those 3 separate boxes for your action plan. I also should let you know now that when we're done with this whole process, we are going to send out a quick survey to you all to see how this went. And so if there is any suggestions on things that could be easier or make more sense as you're going along, think about this as you're filling out your application in Qualtrics. What could we do to make it a little bit easier or understandable? So, okay, let's move on to the next piece. This is the application budget, and Courtney really went over a lot of this, so I'll just briefly go through this quickly. Just as a reminder that there is a template for the budget. So first of all, in Qualtrics, there is a summary budget where you're going to have all the line categories where we want you to put the total dollar amount. But in addition to that, there is a budget template that we need you to complete, because that is the document, as Courtney mentioned earlier, that has to be sent to CMS for approval. So that itemized budget template will need to be uploaded, and there is a spot for that in the Qualtrics survey. It has 3 components: the cover part, the budget, and then the lease versus purchase. And again, Courtney went over those. Please make sure that you are really providing enough justification in there, because once again, that's the part that moves forward to CMS. As Dirk already talked about, approximately 37 awards of 270,000. Each is expected that we're going to award in year one. Don't forget that you can request a higher amount and make sure that you're just prioritizing that. When you're going through the Qualtrics survey, you know, when you get to the narrative part and you're doing your strategies, we already put that, you know, we want you to number your strategies. We'd like you to do the same thing when you get to your action plan. If you can put them in the same order in your strategies and also in your budget, if you could order those so we can make sure that we just know like which ones are tied to your top priority. So if you can number them, that would be great. The funds are governed by provisions in the 2 CFR Part 200 and 2 CFR Part 300. And there is more information about that in the frequently asked questions. And then again, the limits and unallowable costs detailed in this section come from federal guidance, and they are non-negotiable. Okay, let's move on now. So when you got all that work done and you've got your application, it's time to submit. So as we talked about earlier, applications are going to be submitted through Qualtrics. And some of you are probably very familiar with that. It is a pretty easy user system to use. You can start, save, and go back. Our EPI folks that created the survey for us wanted me to remind you that to resume a survey later, you must use the same computer and browser because progress is stored in your browser cache. So clearing your history or switching devices will prevent returning to your saved survey. So please remember that. We do, of course, encourage you to submit early to avoid technical issues. Once again, as a reminder, those applications are due by 5 p.m. Central Time on April 30th. If we don't receive your application by that date and time, it will be considered non-responsive and it won't be reviewed. Just again, as a reminder, so to this, you're going to answer everything in Qualtrics, and then there are 2 attachments that are going to be required. One is that approval of the grant application by your hospital's governing board. That's in the project narrative section. And then there's that budget template. What we really want to remind you is we don't want you to struggle. Please, if you have any questions at all as you're going through this, we have a whole team here that is ready to help you. As Dirk mentioned at the beginning, your success is our success. We're a team here in North Dakota. We're all working for the same thing. We want the residents of North Dakota to have the best care and services that they possibly can. So reach out to us. We're part of your team. We're here to help you answer any questions. We're going to do that in just a minute here, but please know throughout the whole time that you can submit questions to that inbox. We've got that several different places in this PowerPoint, and we will be very responsive to your questions. And all of the questions will be added to a frequently asked questions document that will be up on the website. So a couple more slides for me, Anna. Next slide, please. Once again, process and timeline. So that May 1st to the 30th, you guys now, once you submit your application, then that's where our job starts again. We're going to review and we're going to have a scoring committee. We are going to communicate with you if there's any adjustments needed. This particular funding opportunity is not competitive in the fact that we do have enough funding to give $270,000 to each of the critical access hospitals. Where the scoring criteria is going to be coming in is if we have those additional funds that are going to be available, or if for some reason maybe we don't have a hospital that asks for all of their funding, for all of that $270,000. So the applications will be scored for that reason. We do need approvals by CMS and HHS leadership, and then we will also be doing the agreement development during that May 1st to May 30th timeline. Okay, next slide, Hannah. Okay, we just want to very quickly talk about reporting. So we talked about this a little bit. You are going to be required to submit some reports to us. Your reimbursement requests are going to come through what we call PRS, was a program reporting system. Some of you, if you already have contracts with the public health area of HHS, may be very familiar with PRS. If you're not, no worries. We're going to walk you through it. We'll get you set up. So, but just for awareness, those are reimbursement requests. We also are going to have other types of progress reports that are going to be required, like impact stories, progress reports that include metrics and use of funds. We're still developing the templates for all of that. And so in the agreement that you get, we will have due dates and additional information on how all of that's going to be provided to you. All right, I think that's all I have. I'm going to turn it back to Dirk, who's our Executive Director of our Public Health Division here in HHS, to go over some of the questions.
Thank you, Kim. That's why Kim's the best. She remembered to introduce me, who went first. So thank you, Kim. But as Kim said, we are going to walk through some questions. First, we're going to review the questions we've already received in advance of this technical assistance call. And then we are also asking for you, if you have questions, like I said, submit via chat, and then Steve will provide those things, and we'll try to answer the ones we can here on the spot. And then we will also, as time allows, and it seems like there will be some time, raise our hands, and we'll be asked to be called verbally to do some one-on-one dialogue that way too. As a reminder, Funding Opportunity FAQ will be added to the website after this call. So all of the questions we get and all the questions that are submitted, we will be adding that to the FAQs. To be specific, the questions that we're answering today and the FAQ we're talking about is specific to this funding opportunity. So if there is questions about the broader Rural Health Transformation Program, don't want to discourage you from submitting those chats, but that will not be answered in this technical assistance call, but we would be putting that on the FAQ document we developed for the broader Rural Health Transformation Program. Next slide, Anna. So these were the questions that were submitted in advance of the call. First question is, can two facilities that fall under the same EIN both apply for this funding? The answer to that is yes, as long as they're in separate locations. We do know that there are some critical access hospitals that have the same EIN, but they are in two different locations. So both of those locations are eligible. Are funds available for long-term care facilities that is connected to critical access hospital? The funding opportunity is yes, as long as it's part of the critical access hospital and part of their owned and operated clinics. So it is designed for the critical access hospital and the clinics that they're connected with. I'm an independent provider, EMS. Am I eligible for this funding? Not this funding. Only critical access hospitals and their owned and operated clinics are eligible for this funding opportunity. We are anticipating having another funding opportunity for other providers, hopefully in the near future. So I would look forward to that opportunity, which will be similar in terms of how this was structured. Will there be additional retention opportunities for other provider types? We have submitted the question for CMS, and we're requesting guidance for other provider types will be allowed. Once CMS responds to that question, we'll provide further information, and we'll make sure that we're putting that as part of the FAQ document that's developed. Anna, next slide. Where is the information on creating a portal to begin the application process? The information can be found on the funding announcement application submission link that's provided there. Applications must be submitted through NDHHS through Qualtrics. I would encourage you to go to the Rural Health Transformation page that's on the HHS website, and it'll help navigate you to these different links as well. Do all organizations need to register with SAMHSA.gov and receive a UEI number to receive these funds? Yes, and that information regarding this will be added to our website. If a critical access hospital has an adjoining nursing home they own, is it allowable to include a retention strategy for the nursing home employees in addition to the critical access hospital employees? Once again, yes, as long as they're employees of the critical access hospital and their own and operated clinics. So we are really treating this as the system, not just specifically the critical access hospital. Next slide. Before we open it up for the questions that were submitted to Steve, online. I will just want to highlight the resources that are available. So this is the Rural Health Transformation webpage that I've been talking about. It's at hhs.nd.gov/rural health transformation. You go here, you can sign up to receive all the email updates as they come. The funding guidance is also at that website link. And then you can always email rhtp@nd.gov for additional questions. Please identify the funding opportunity and number in the subject line. It helps us kind of streamline those questions and make sure we're getting back to you as soon as possible. But with that being said, I'm going to ask Kim and Courtney to pop back on camera. And then Steve, if you can ask us the questions, we'll try to answer as best we can with the information we have. And once again, if we don't know the answer, we are more than happy to ask CMS for clarity on any of these questions. But go ahead, Steve.
All right, thanks, Dirk. First question that we have in the chat, would passes to a nearby state park for all employees qualify? Also, how would service commitments be enforced and by who?
Yeah, I think that's a great question. We'd probably have to look into the passes portion of this question. I don't think we've asked that question to date. In terms of who would be enforcing the service criteria, it will be a relationship where we have that as part of the grant opportunity for you. And so we would have that relationship to the provider, and then the provider has to enforce it to the employee. So really our relationship is directly to that critical access hospital and its unit that it's representing. You and your relationship with your individual person that would be underneath that criteria, that'd be something that you'd have to manage at that level.
Thanks, Dirk. Next question in the chat we have, can a remote patient monitoring system that monitors patients to avoid one-to-one sitters be an acceptable project?
I'm going to look at my cohorts here. I don't know if that would be a retention opportunity for workforce. I know that there's other opportunities that will be coming throughout the Rural Health Transformation Program that is more designed for equipment and technical opportunities like that. But I'll defer to Kim and Courtney if you have any thoughts on this one.
Yeah, Dirk, I was thinking the same thing with that. That might fit better under technology. But Lisa, if you could provide a justification on how that would retain staff, we could also move that question forward to CMS.
I think that's a good call out, Kim. Steve, next question.
Thank you. Thank you. If the nursing staff is private contracted, can they be converted to permanent employees? This is for staff not employed through an agency.
I think, as we noted earlier in the presentation, they have to be hired at the date that the award was put out into the wild, as I like to call it. We do want to try to encourage sort of poaching from different parts of our healthcare industry. That is something that a lot of people were concerned about. So to kind of combat that, we did have that requirement put onto this funding opportunity. So that's my long way of saying no.
Thanks, Dirk. This next question might be somewhat similar. Can these funds be used to recruit a physician who is currently in residency?
Currently in residence. This is a retention grant and it's not a recruitment grant. We are hoping to have recruitment grants in the future, but this one is designed for retention.
Okay, we had one question about accessing the website, having some difficulties. We can maybe reach out to that person directly. Next question listed, what employees qualify for the retention bonuses?
So I think we provided that list earlier in the PowerPoint. It's essentially medical professionals such as doctors, nurses, physicians, and then allied health professionals such as rad techs, behavioral health specialists, and along those lines. There is a list that we provided earlier.
Thanks, Dirk. This question may be along the lines of that retention that you addressed earlier in the time frame. Do they have to repay if they quit even after signing retention agreement? Who will take the legal action to make this occur?
Yeah, so to clarify that, our relationship and our agreement will be with the provider. So we'll be with the Critical Access Hospital. We will require reimbursement back for people who do not meet that threshold of the 5-year period from the provider. What the provider takes in terms of their action in relation to the employee, that would be kind of on their determination.
Thanks, Dirk. Next question, can you elaborate on the eligibility or exclusion for those participating in loan reimbursement programs? I'm recalling a reference to that as an exclusion. Does this include career builders?
Can you say that question again, Steve? Maybe I didn't get that one. It seems like
Absolutely.
Kim might have an answer, but
Can you elaborate on the eligibility or exclusion for those participating in loan reimbursement programs?
oh, yeah, thank you. So it is specific to people who have already gotten loan reimbursement from essentially the SLRP in our state program. The reason is that you can't get double funded from essentially federal sources. That was kind of feedback we've got back from our federal partners. So that was a federal requirement that limited that. But Kim, if you want to dive in deeper than that, that'd be great.
Yeah, thanks, Dirk. Because it says, does it include career builders?
Oh,
I'm gonna have to, I'm not familiar with career builders, so we're gonna have to, unless somebody else is, Dirk or Courtney are. So we're gonna have to dig into that a little bit. Yeah, so yeah, if somebody's already getting a loan repayment program through the state, unfortunately, they wouldn't be eligible for an incentive program through this retention opportunity. And then the other thing is that loan repayment is also not allowed as a retention strategy. And so we do have that very clearly outlined in the guidance. You can provide tuition reimbursement and professional development, but loan repayment is specifically not allowed as a retention strategy.
Thanks, Kim. Next question, would leadership development opportunities for leaders within the CAH qualify for reimbursement, i.e. purchase of leadership courses?
yes.
Thanks, Dirk. That was an easy one. Are expenses for remodeling in order to create a more desirable work setting allowable?
So just want to make sure that everybody's fully aware that sort of remodeling and any significant construction is not allowed as part of the grant opportunity. Just overall, I think you'd have to talk about level of remodeling and then a lot of detail to get that allowable. It's not that we wouldn't take a look at that and forward that on to CMS, as Kim said earlier, to another question. But I do want to maybe caution if that's the idea of how you'd want to remodel an office or a building, that's not an allowable expense.
Thanks, Dirk. Are the repayment of retention incentives prorated over the 5 years or 100% of what was given if to the employee?
Courtney, do you know the answer to that?
So if I'm understanding the question correctly, so if we pay out, we'll just say $1,000 to somebody in the first year and they participate for 3 of the 5-year retention, I do believe we can do on a prorated basis, but I will double check that one to verify its accuracy.
Yeah, I think that's my assumption as well, but thank you, Courtney.
Next, we have specific to other folks working in the CH. Basically, they're asking business office, housekeeping, dietary, admin staff, etc. would not be allowed. With a question.
Yeah, that is the question that we asked earlier and forwarded on to CMS for follow-up, and we have not gotten an answer back on that. We know that the kind of health provider side of the equation is allowable. We did ask the question about just what you talked about, and so that is something that's a pending question with CMS.
Thanks, Dirk. Next question, is there flexibility in how a retention bonus is paid so that it is paid, for example, a portion after each year of the 5-year commitment is worked? They go on, so a provider is paying after the employee completed a year and does not have to chase an employee for reimbursement if the employee leaves before 5 years are up.
The only caution I have about that strategy is that kind of the there's an obligation period and a liquidation period. And so the money has to be spent within that first year. So think about, I think the liquidation period is is September of 2027. And so if you're doing that kind of tag along cost process or plan, I'm not sure how that would be executed within the liquidation period, since you have to essentially provide that up front. But Courtney, I don't know if you have any other thoughts on that.
So it is, you outlined it exactly as is. It does have to be liquidated within that period. Otherwise, it would be outside of the period for that first year funding.
Thank you, Dirk and Courtney. Next question, if a participant has to repay any amount, is it minus taxes taken from the disbursement they received?
Courtney, I'm not sure if you have that answer. That might be one we'd have to ask CMS on, or.
I would need to verify that before answering that question.
So we'll get that on the FAQ. That's a great question.
Thanks, Dirk and Courtney. Next question. For the cover sheet on the budget worksheet, we are planning on retention bonuses. How would you calculate the expected rate of compensation?
Thoughts, Courtney?
Can you repeat that again, Steve? Sorry.
Absolutely. For the cover sheet on the budget worksheet, we are planning on retention bonuses. How would you calculate the expected rate of compensation?
So I'm going to use an example. Hopefully this answers the question. We're just going to say person X receives $5,000 a month, and you decide as an agency you would like to propose 10 people at a 10% amount for 1 month, for example. So something along those lines of detailing out how many individuals, what is the percentage of the retention calculation, to then get to your total amount requested. It may vary, or it is allowable to vary between role or position types within your agency. It's all depending on how you want to create that retention structure. I think that answers the question. If it doesn't, please come off mute and ask a follow-up if need be.
Thanks, Courtney. I'll just go to the next question, and if the person that asked that would like to jump on, please go ahead. But could the retention payments be put into accounts that the person could only access at specific times, i.e., e.g., bonds cashable at a specific date? As far as hospital is concerned, the funds would have been dispersed.
Courtney, I'm going to defer to you on this one too.
So I see where they're getting that on a reimbursement basis, the funds would be expended on their books. I would have to verify timeline. So specific dates may have to be within the required timeline of available to the recipient. So I would have to follow up on that portion if it were to fall outside of that, our obligation and liquidation periods.
So we'll follow up on that one. Because the questions are getting trickier. I like it.
Okay.
Well,
I think I've reached
hold on, Steve. I am
go ahead.
going to say that one also depends on how they write it into their justification. So I'm going to say that one may be a direct question with myself or my team to help understand further.
Thanks, Courtney. I have reached the end of the messages in chat.
Okay, well, we have 7 magical minutes left. So I think if anybody's willing or wanting to come off and have a direct question, we will be giving that time up for anybody. And once again, it would be related to this technical assistance opportunity for this grant opportunity. I see Jack McTaggart had a question.
Clarification on, since long-term care portion of my critical access hospital is eligible, looking at the staff that would be eligible, is it just my nursing staff within the long-term care? Or is it, again, I know you'd looked at the housekeeping and others that you're waiting for an answer, but I'm just trying to clarify, get that expanded a little bit.
Yeah, I think it's any allied health professional that would fit within that bill. So I think it'd be a little bit beyond the nursing staff, potentially CNAs and such like that. But we could ask that question further if you wish.
Yes, thank you.
Any other questions that people want answered or follow-up questions that we can hopefully help provide?
Dirk, I might slip in with one more from the chat that's just popped in.
Awesome.
When calculating potential employee bonuses, say for 10 employees for a total cost estimate, what if only 5 employees decide to take the bonus based on needing to sign a 5-year agreement? Can the funds be moved elsewhere?
I can take that one. So yes, with a budget amendment. So we would have to get a resubmitted budget. Anything outside or changing within the initial budget submitted would have to be resubmitted to me or my team to get approval from CMS. Any changes that we make to any of our contractual agreements will have to follow that.
Thank you.
And I think the last thing, we had a question in the chat about FQHCs and future funding. So I don't know if we wanted to touch that here though, or if that would be better served at a future one.
Unless I would say, here's what I'd say, since we have those 5 magical minutes, I would say unless the category in the question would apply to this opportunity as well. Steve, did we lose you?
Nope. It's basically about FQHCs listed in the overall RHTP, so not
Okay.
specifically to this one.
Okay. Thank you very much for that clarification.
Last in the chat now, we have, can you put the slide back up about who qualifies for the retention funds?
Yeah, and just for clarity, we will be putting this kind of this recording and these slides. I believe we're putting them on the Rural Health Transformation website, so you guys will have access to this as well.
Dirk, last one that we have in the chat here. Housing is a retention option. However, we cannot purchase a building. Would the CAH be able to purchase housing as it is residential, not commercial space?
I do believe that's a potential. In my head it is. You guys can correct me if it's not. But it would come with that 5-year service commitment for sure.
I will make sure when we publish the FAQ that we include more documentation around that one because there are very limited scopes allowable within the agreement. So I will try to kind of put some verbiage together. Some things can be, but some very clearly cannot. So it's going to be a little bit of a, it depends that I will add more verbiage for.
I think that's a good call out. And as anything, all this would have to go through not just our review and approval, but ultimately CMS's review and approval as well. All right. Well, I think with 2 minutes left, we've done a good job of filling the time, and I do appreciate all the engagement and questions related to this opportunity. Special thanks to Kim and Courtney for participating in the presentation with me. Obviously, I started slow and they build up to a great finale. So way to go, team, on that. And so just want to be extra thankful and thoughtful to all of you participating in this opportunity. It is our first chance at having a grant related to rural health transformation. And we do think this is the right group and the right target to have that opportunity. So Thanks for all the work you do, and excited to have this opportunity out to all the critical access hospitals. So with that, we'll call an end to this call and appreciate the participation. Thank you.